Okay, dear students, uh, I think all are in good health. Uh, I was waiting for a handsome gathering for the last 10 minutes, but I think it will not happen. Still, it is only 15 who already gathered here. Uh, so this is not an ideal gathering to deliver a lecture. Anyway, as this class is scheduled, so I am continuing from the previous lecture. You see, this is another SCQ. A 55 years old female was admitted in medical ward for generalized body ache and collapse of lumbar vertebral body. She was treated with a drug for her skin disease, pemphigus vulgaris, for a long period. So, there is a long description. As I told you previously, in several occasions, when there are much more information in the clinical scenario, then very logically, you are supposed to be asked a single diagnosis. The same thing is happening here. So in that case, you have to make the clinical input out of that clinical scenario. What is the input here? Is an old lady. It is 55 years and she is a female. Okay, admitted in medical ward for generalized body ache, collapse of the lumbar vertebra. The aged female presenting with generalized bone pain, which is the body ache, maybe as the body ache may denote the bone pain as it is associated with a collapse of the lumbar vertebral bone. So the scenario here, an old female presented with a collapse of the lumbar vertebra. There is no history regarding the acute onset or this is following a trauma. Is not, but she is taking the drug for her skin disease, pemphigus vulgaris, for a long period. You know the skin disease pemphigus vulgaris, and for this, the drug of the only one drug that is even for that particular condition, that is one sole indication, that is the corticosteroid. You should know that. That is, he is taking corticosteroid for a long period. Is not it? So this is the clue here. This is a tricky one. So you should know the diagnosis of pemphigus vulgaris, and you should know the treatment of that particular condition. Sometimes straightforward you will be given that clue. The patient is taking corticosteroid for a long period. So same thing is same here. So clinical input is patient is an old female. She is taking corticosteroid for a long period and is presented with a body ache and a collapse of the lumbar vertebra. So these are the clinical scenario. So 55 years old, which is the postmenopausal women with corticosteroid, is a multiple risk factor for osteoporosis, osteopenia. And presentation is body ache, yes, and lumbar vertebral collapse. So osteoporotic fracture, very typical in the vertebral spine, lumbar spine. So all these scenario goes in favor of a diagnosis of osteoporosis. So very logically, the single diagnosis. What is the diagnosis? That is osteoporotic fracture of spine fracture. What might be the name of the drug taken by the patient? Yes, this is another question maybe asked in the MBBS exam. In the skin chapter, when you are telling a diagnosis of pemphigus vulgaris, you should know the treatment of that particular condition. There are only one treatment, that is the corticosteroid. So, the name of the drug for these patients for this particular type of condition, that is pemphigus vulgaris, and he has to take this for a long period, several years. Okay. Okay, so the answer of two fraction of the question A is very much important. There is no ambiguity, no multiplicity. So you should write the two things. That is diagnosis is only these two words will carry the full marks of 1. Okay, is it? Okay. Then the fraction B. What is the investigation of choice? Very much bookish question also. Enumerate the indications of this investigation. Okay, when you are encountered with a patient with osteoporosis, especially of a old lady, a postmenopausal lady, so what is the investigation of them? That is only one investigation. What is it? This is BMD, bone mineral density metric. It is done by EXA, well energy X-ray absorptiometry. It is written in the book EXA, EXA. So this is the investigation by which we actually measure the hydroxyapatite crystal that is formed by the calcium phosphate. The total calcium phosphate content of the body of the bone This is the investigation. This is the investigation. Whole body, lean body mass, total fat mass will also be calculated. This machine, that is the BMP machine, dual energy X-ray absorption, and by this DEXA scan, we usually measure the density of the bone. This is the density of the bone crystals, hydroxyapatite crystals. So this is the investigation of choice. And in the exam, if you were encountered with questions of osteoporosis, you may ask what is the T score and what is the Z score. You should memorize it. You may answer these two questions in your Viva exam also. If you are with the questions of osteoporosis, you should memorize it well. What does Z score means? What does T score means? Because when you be a doctor and you are in your family member gatherings, sometimes you may be asked with a report of BMT. What does it tell actually? You have to counsel your relative. If you don't know that this score or that score, you can't make any explanation of that particular type of investigations, and in that case, you would be in an embarrassed situation. And as like we also, as with the teacher, we could not make you understand what is T score or Z score. So you should go through the book, what is T score and Z score. Enumerate the indications of these investigations. This is also a bookish question that it actually refers to a box of the Davidson in the chapter of osteoporosis. Okay, so what are the indications? One indication is clear here. If any patient above 50 years with risk factors like patient is taking 22 steroids for a prolonged period, this is the indication. Another is patient has got a fracture, low trauma fracture. Patient has got a collapse of the lumbar vertebra, osteoporosis fracture. Patient has got a high risk factors of osteoporosis, even age is less than 50 years. Patient if in young age, they are not risky of being bones becomes osteoporosis, but there are multiple conditions where even in young age it is with increased risk factor for osteoporosis. As like patient is taking corticosteroid for another condition, patient has got Cushing syndrome, Cushing disease as well, patient has got hyperparathyroidism, patient has CKD. So all these parameters left even a young patient in danger of osteoporosis. So if the patient is young but he has got risk factor for osteoporosis, he should undergo DEXA scan. Patient is taking corticosteroid for a long period. If it is more than 7.5 milligram for more than 3 months period, then he is also in risk of osteoporosis, and this is an indication for DEXA scan. Low trauma factor. What is low trauma factor? This is also another one. Low trauma factor, if the patients experience any fracture in any kinds of the bone with a history of fall less then the height of the patient. This is the load zone of action. Uh, in osteoporotic patients are very much prone to develop this load zone of action. This is also another indication. Uh, Osteoporotic female, if the patient is postmenopausal female, has got the risk factors of the osteoporosis, she also member of this DEXA scan. So these are the indications of DEXA scan in osteoporosis. Mind it, in case of osteoporosis, if you are with a questions related with this, you may be asked what are the risk factors of osteoporosis and what are the clinical conditions which patients are in patient is prone to develop with osteoporotic factors. As I said earlier, these are some drugs may cause patients in danger of osteoporosis. One is corticosteroid. So once you are and name of the drug corticosteroid for osteoporosis, you may be asked a supplementary question name some other drugs that cause osteoporosis. So in case of osteo also, you are very much familiar with the questions like 10, 4 or 5 options of any questions, like name 4 drugs, name 5 drugs. So when in such a question scenario, you should memorize 3 or 4 items ready to deliver, either in Viva or in the WhatsApp. Like that here also. So one of the drugs, one is corticosteroid, another one you should memorize. Another is hydroxyl drug. Yes. Another alcohol. Another 21,000 drugs. Because it is C, outline the management plan. So what will be the management plan for the patient? So, patient has got the generalized body. Number 1, patient has got the complaint of pain. Number 2, patient has got a collapse in the lumbar vertebra. These two. And another condition is patient has got a diagnosis of pemphigus vulgaris for which he is with corticosteroid for a long period. But these 3 conditions should be kept in mind before you are planning and management of this particular disease. Is not it? So what will be the pemphigus vulgaris? He has to take steroid for a long period of time. So you should consider whether this steroid he is getting is optimum for the patient, if it is more or not. So if the dose of the corticosteroid can be reduced, it should be done. If the steroid no longer required for the management of the patient, it should be stopped. If there is any steroid sparing agent to be added with the patient's current treatment option, it should be considered. So these 3 options should be taken into account regarding the steroid treatment of the particular. Number 1. Number 2, for generalized headache, you may consider NSAI, non-steroidal anti-inflammatory if it is safe for the patient. You don't know the kidney profile of the patient. Okay, we can give paracetamol, we can give non-steroidal anti-inflammatory drug, we can give tramadol hydrochloride for that particular type of pain management. Another question is collapse of the lumbar vertebra. Yes, if the lumbar vertebra in that situation creating problem of the surrounding nerve plexuses, surrounding spinal cord, so it should be fixed so that sudden neurological compression or neurological problem does not happen. For that, you have to seek advice from neurosurgeon. Okay, so regarding lumbar vertebral fracture, we should consider all these things. And even surgical management of that particular type of lumbar collapse vertebra, articuloplasty, again another term. Sometimes in osteoporotic patients there is fracture of the next one, quite common in the older age group. In that case, what we done? Arthroplasty, total hip replacement. So these kinds of treatment options in the management of the particular patient should be taken into account. So what happens when you are answering these questions outside the management plan? All things are focused into the treatment of this cosmetic therapy. You make a detailed management of this cosmetic therapy. But if you are writing even elaborated management with this cosmetic, you will get in a fraction of the total number. Where this total number is given according to the heading, that is the management of the plan, management of the body ache, management of the column vertebra, management of the regarding the steroid therapy. All things may in the answer key may have the number 1, and 1 is left for the discussion. If you write down the management of the discussion only, you will getting only 1 to 50% marks of the particular question. So when you are asked to management plan a particular patient, try to manage the patient to the goal. What is the scenario? What is the patient profile? And what is the clinical condition of that particular patient? Considering all this, you should make a plan of that particular patient. You need not elaborate of the whole management plan. Just make a note of the headline. If, for example, if this patient, if you tell treatment of the underlying condition osteoporosis by this postulate, okay, number 1. Number 2, treatment of the pain by paracetamol and NSAID. Okay, so treatment of the column vertebra, vertebroplasty may be required and use surgical option C. And management of the steroid management of the particular patient. If not required, omit steroid. If dose reduction possible, reduce the steroid. If steroid sparing agent, okay. Just these few words, if you tell by section, focusing the target management goal, then you will get full marks. So this is the tips how you write a management plan of a particular patient. 5 years old fisherman admitted with high grade fever, pulmonary crash for 5 days. He was found toxic and his eyes were congested. Serum bilirubin was 5 mg per dl and serum creatinine was 4.5 mg per liter. Okay, again this is the scenario. I want to draw your attention to the particular profession of this case. That is the fisherman. You should emphasize on that particular point. Sometimes the area is focused in your scenario. A patient came from Rangamati. So when you are in undergraduate student MBBS, you are giving an idea of an endemic area. So you should have the idea what is the endemic disease that is encountered here. What is the profession? What is the disease that is related with that particular profession? So a particular thing of that point will make a diagnosis clear. From Rangamati, very likely it will be malaria. Fishermen, some related disease that occurs fishermen in aquatic environment. It's not it. Some patients come from Myeloid, something related with color. Some patients coming from Jamalpur. Sometimes this is pilating. It's not it. So this endemicity, some profession oriented with a particular type of disease, you should have an idea about that particular profession or particular area. Fishermen, okay, low-grade fever with purpuric test for 5 days. Fever with purpuric test. If you go to the posology from your third year knowledge, fever with rash, what is the differential diagnosis? Very likely fever with rash in that particular endemic area, particular season, you are very much ready to fall with the diagnosis to the dengue. Then, what is the reason of keeping the fishermen? Dengue is prevalent in the people that are engaged in fishing. Is it? So this is the question now. Dengue, yes, dengue may be a possibility. Why? So, fishermen. Okay. He was found toxic. Yes, dengue patients may be toxic. His eyes were congested. Serum bilirubin was 5 milligram per day. So dengue is phenol. Creatinine was 4.5 milligram per day. Even dengue is not different. So what is the probability? What is your probability diagnosis? So as there is much more differential diagnosis, but question here is on the differential diagnosis. These patients may have multiple differential diagnoses. But what is so these kinds of scenario you may face in FAQ in your Viva examination. In some Viva, there are some questions that you are delivering in this scenario, animated scenario from your examiner, and you are telling what is your working title. So in the that side, with your clinical scenario, you have to make a diagnosis, prompt diagnosis of the particular patient, and with that diagnosis, you have to start your treatment. These kinds of situations will be created not only in your Viva exam, but also in your real life. When in acute patient, you have to make a clinical diagnosis, and you have to stand with that diagnosis for managing this patient. Isn't it? This is the mock of that particular situation. What is your role life? As he is determined, and this is the clinical scenario. So, most likely, the diagnosis is leptospira, the wild bacteria, usually zoonotic disease, called its habitat in rodent, in renal tube of the rodent. And with that urine is contaminating the water. And if any person living in water for a particular period of time, extended period of time, as the patient does, and is wild motile bacteria may enter into the skin, even to the insects. If there is abrasion, the skin or mucous membrane, its entry is facilitated. So, in that particular fisherman, this is the scenario of that leptospira. So, the probable diagnosis will be leptospira, not dengue, not falciparum malaria. In falciparum malaria, yes, patient may have high grade fever, but during rest possible conjunctivitis, bilirubin high, creatinine low, all things may happen. So, the differential diagnosis may malaria, it may dengue, high grade fever, uric rash, toxic, hypotensive, bilirubin high, why not? Possible. Why not? Possible. It is also possible. Why not enteric fever? It is also possible. Such as bilirubin high, creatinine high, rash, why not hepatic encephalopathy? All the differential diagnosis may happen in that patient, but the probability will be indicated by this professional. So this is the tricks of that particular question. And these questions are designed to animate the situation. You may tell what are the main conception of this one. Sadly, this is this question of the leptospirosis. The book is well written that leptospira has the fourth medical syndrome. Isn't it? Isn't it? bacteremic sepsis, yes. Number two, aseptic meningitis. Number three, Wells disease. Hepatitis, and the pulmonary sepsis. These four written in the baby. So this you should name the four clinical symptoms and maybe for one or two subjects of this particular symptom as well to tell you the full mark. As like in case of epidemic, patient presents with high fever, patient is toxic, myalgia, cough, pain, nasal pain. And only clinical sign here, the eyes become focused, patient may toxic. This is the bacterium. Bacterium. Aseptic meningitis, again, patient will be dry, and also there's a meningitis. You get the case of meningeal irritation. Again, eye may be congested. Nothing more than these physical examination findings. Uh, in case of uh, Wells disease, patient will get the features of acute hepatitis like patient who has jaundice, jaundice, there may be rash or urine test also. Patient may have the features of full fermentation as like hepatic encephalopathy. Patient may have features of acute renal failure. All clinical features and also radio laboratory findings of high creatinine may be possible. So these features quite warrant whether it is important hepatic encephalopathy as well as another is pulmonary symptoms. These patients usually present with stomach in the lower respiratory presentation sign with stomach respiratory failure, and heat condition may be associated with acute renal failure as well. So these are the clinical symptoms of the gastroenteritis. That is, the patient may come with a feature like fever with rash. This is the one thing. Sometimes patients present with features of acute hepatic encephalopathy. Sometimes patients present with acute renal failure. Sometimes patients present with respiratory symptoms. There's an actual core condition. So which patients of gastroenteritis may take the one. The second point is if any particular patients of such profession came to you acutely with any of the four clinical phases with a febrile condition, you should consider whether this is a leptospirosis or not. Okay. You monitor the drug treatment of the condition. Before that, sometimes questions in leptospirosis may warrant a questions how you will diagnose it. What are the investigations that is regarded for the diagnosis? What are the investigations you will do to explore the differential diagnosis? These kinds of questions may happen. Even in the viva exam, you may be asked what are the investigations, what are the investigation of choice of that particular form, particular disease. So that monoagglutination test for the high specificity, for a moderate sensitivity. This usually becomes positive after week testing. This can be done from a serum sample, from a urine sample as well. You may go for blood culture, but blood culture requires more than 2 weeks, several weeks of culturing required to get that organism. So this time-consuming report will not favor the treatment of the disease. Even antibody titer of that particular sport for titer is significant. So again, these will require a time. But before that, the treatment of the patient is very much necessary. So next is the investigation of choice. Now, PCR test. PCR. PCR for diagnosing leptospirosis is a good handy tool for the diagnosis of leptospirosis even outside. So these are the investigations available for the diagnosis of leptospirosis. for excluding the differentials, you should go for the test of dengue. That is, you can go for if it is RD1, you can go for the dengue antigen test, and is one. You can, it is more than 5 days. You can go for the IgM or IgG antibody for dengue. Go for the CDC for dengue constitution. You can go for the malarial parasite as well. You can go for the liver function test. Go for the renal function test, electrolytes, urine examination. So these are the investigations. This test is also important for investigation. You can go for the imaging, ultrasonography of the abdomen to get any liver pathology. So all the investigations is necessary for this particular test. Can you monitor the draft treatment of the condition? So here, not the management plan. Here, the straightforward, the draft treatment of the condition. That is, you should write down the pharmacological treatment of the what are the antibiotics that are necessary for them. Doxycycline. Here the condition will be self-limiting as well. Doxycycline for 7 days. You will use penicillin for 7 days. You can give anyone. You can give child. Okay. This is the draft treatment. And before this draft treatment, the treatment of the management plan of this patient. You have to treat the patient as well for fever. Patient is mercury based, encounter for the thrombocytopenia. You should treat like this for transfusion of liquid transfusion or blood transfusion. Patient has got high bilirubin, so there is hepatic encephalopathy. You should manage the patient as well regarding whether there is hepatic encephalopathy or not. Creatinine was high, patient may require dialysis as well. So if you will ask the question regarding the management plan, you have to follow the sequence that was for the early, the previous question, as I told earlier. So here only the draft treatment. So you should mention the treatment of the antimicrobial treatment of this particular condition. And here the number given also only one. So this is the distinction of these two questions. So one question is management plan and one question is the particular specific treatment of the condition. So you should answer the question according to the main. Otherwise, it will be time consuming and you unnecessary long detailed statement will take time. For that, okay. If there is no question, the last question is a very simple one from psychiatry. It's not my topic, but this question is being asked in while also. A girl of schizophrenia, 17 years old, presented with tremor, hypokinesis, rigidity, and hypersalivation after 3 weeks of taking medication. Medications for schizophrenia. That is the antipsychotic treatment. The antipsychotic treatment has got some side effects like tremor, hypokinesia, rigidity, hypersalivation. Okay. What is lupus? Very much familiar question with the EPS, extrapyramidal syndrome. Extrapyramidal syndrome of that antipsychotic drug. Mention the immediate treatment of the above condition. So, what is the immediate treatment of this above condition? What will be the answer? Everybody will get dihexyphenol, anticholinergic drug is the treatment of the exactly right. But for this, number 2 will not be enough. For number 2, this answer will not be enough. You will get 1 for this. So for this above condition, you have to try to stop the offending drug. If the antipsychotic drug is the culprit one, then you have to stop it. And if the condition of schizophrenia does not warrant you to stop this drug, you have to reduce the drug. Number 2. And if the dose reduction is not possible and patient is getting this kind of extrapyramidal syndrome, you have to change this antipsychotic drug from first generation to newer one, older one to newer one, novel antipsychotic drug, like respiratory, clozapine, olanzapine. These drugs should be replaced from haloperidol, phenylpheniramine, drug. These older drugs, antipsychotic drugs, are very much notorious for the extrapyramidal. If this is the cause, then you have to continue with antipsychotic drugs. You just replace this old drug with novel one. So these three things should be written for immediate treatment option. So you treat with the anticholinergic drug, dihydroxyphenamide, you may give and the other thing, you have to stop the drug, you have to reduce the dose, or you have to change the drug. On outline the further treatment of schizophrenia. This is a bookish question. How you will fix it? Again, you will mention the three things. You have to reduce the dose. You have to change the antipsychotic drug with another one. Another thing is education. Education to the patient and his family as well. Social rehabilitation of the patient is another important portion. Cognitive behavior therapy may help schizophrenia. So this is the treatment option. Only the drug treatment is not enough. You should mention the education of the patient and his family or support member group as well. You have to mention the social rehabilitation of the social treatment, cognitive behavior therapy, modality of the patient and family member education also. And I think for undergraduate students, this is enough for to be weakened in the SCQ section. But regarding the treatment of this condition, you should not only mention the name of the drug. That you mention the name of the drug or so there are so many drugs. So many options. But the mainstay of treatment is the anticholinergic. That's very good. But before this, you have to stop. You have to take. You have to change the drugs also. If required. This thing should be done. Okay. This is the posters of the solution number 8. Number 8, and I want to tell you clearly what are the tips behind to make a complete answer of that every section of your SCQ, so that you may write a little with your stipulated time, but get the maximum number, that is particular question. For this, you must be familiar with the scenario that is given in your question, and also to understand what is the intent of that particular. This two is very much important. One, you have to be clear about the clinical scenario of the patient, and another one is what is the merit of the patient. If these two things you work out before you answer your question, then it will become easier for you to answer. So this is for today. I think for SCQ, there is no scope to go further with other SCQ, and in the next classes, what topic to be discussed, if you just communicate with me through your monitor, it will be helpful for you. What you need to discuss in the next classes, please you consult me through your monitor, then I can prepare the next classes for you. again, request for you, please in time you gather together for a successful lecture session and try to communicate, try to interact with the session. Okay, okay, be well, be safe. Thank you today. Again, if you have any question, still there are some moments left, you can ask me.